Northern Nevada Medical Center primary goal is to provide excellent patient care, but continually evolving research is sometimes hard to keep up with. And this is where the Get With the Guidelines and other type of program comes in. So the Get With the Guidelines is proven in hospital approach on improving patient outcomes across cardiovascular and stroke-focused areas.
For our patient, this is another example of the efforts of a system, of a health system, in doing everything possible to provide the best care. It means that from nursing staff, from the hospitalist team to the cardiologist team taking care of you, are doing everything possible to both educate you and your family and provide the best care possible while you're in the hospital and the follow-up.
So some of the measurements that were met were making sure we were keeping track of the patient from admission to discharge, making sure they were getting the proper medications for their diagnosis. After discharge, making sure they were being followed through, and tracking just everything else in between.
Every day, Angelica and I, we track the patients that are admitted for heart failure. So once patients are admitted with heart failure, we start measuring all the requirements that are needed for this award. And we follow the patients daily up until discharge. And then once the patient's discharged, we send that information over to Janie, who is the heart failure coordinator. And she works with Dr. Gonzalez, one of the cardiologists, and they ensure that patients are on optimal therapy for their heart failure, and ensuring the patients are seen within the office and for follow-ups. And then once a month, Janie, Dr. Gonzalez, Angelica, and I, we have a heart failure team or committee, meet with the different directors and managers of the unit floors, and we go over the specific measurements that are needed for this criteria, and we see how we can better improve our scores.
Well, our pursuit is to provide excellent medical care. In this case, we have a prestigious institution as the American Heart Association recognizing North Nevada Health System to be compliant with these guidelines.
There is different criteria to meet this award, but I think the biggest asset that Northern Nevada Medical Center have is having a strong heart failure program. You know, having a program that have framework and have a good handoff process between inpatient and outpatient, and offering patient support and care all throughout their cardiac phase.
We pursue these types of awards and recognitions to reassure our patients that we have the most up-to-date knowledge, and we provide the best care that they get, leading to higher quality of life.
And I just love taking care of the patients and the instant gratification that we get with our cardiac patients when they're started on different medications or different procedures. For instance, like a cardioversion or pacemaker, we can see the patients, just the difference in their life and quality of life that there is.
Well, growing up with your dad as a cardiologist, you see that the impact is not only in direct patients for everyone around you, and more in my personal life, the satisfaction of knowing that you can help change someone's life for the best, it's more gratifying than anything in the world. And I think that in the case of cardiology, you have that opportunity day in and day out. It's a lot of work. It's both physically and sometimes emotionally hard, but at the same time, it's so gratifying.